Peanut allergies are more prevalent among children under 3 years old, and the risk of developing this allergy increases to 7% for a sibling of a child with a peanut allergy. This is why peanuts are among the Big 8 food allergies, along with eggs, fish, milk, tree nuts, shellfish, soy, and wheat. What's really disturbing is that there's no clear, definitive reason why this common food allergy is on the rise, but new research in the New England Journal of Medicine and The Lancet suggests that avoiding peanuts at an early age may be partly to blame. And, on top of that, recent research shows that consuming minuscule amounts of peanut protein combined with probiotic supplements can significantly reduce peanut allergies and sensitivities in children. Peanuts can be dangerous to those with the condition. Exposure could lead to anaphylaxis, a serious allergic reaction that could cause death. There are millions of people living with the condition around the world today, but the medical community has yet to determine what directly causes peanut allergies in different populations. However, there are ways to prevent peanut allergies. Recent studies suggest that diets in early childhood could play a significant role in the development of the condition. Here are 5 effective peanut allergy cures. 1. Quercetin. It is a plant flavonoid present in fruits, vegetables, and grains. You can also get quercetin from red wine and green tea. Quercetin has been shown to block allergies to certain foods, including peanuts. A study published in the Iranian Journal of Allergy, Asthma, and Immunology analyzed the effects of quercetin on rats with peanut sensitivities. Over 4 weeks, the rats were treated with 50 milligrams of quercetin daily. The researchers found that quercetin completely abrogated peanut-induced anaphylactic reactions, concluding that quercetin could suppress peanut allergy symptoms and work as an alternative treatment for similar food allergies. 2. Probiotics. As scientists research the critical role of intestinal microbiota in the development of immune tolerance, there is more and more interest in the benefits of probiotics. Probiotics are able to recolonize and restore microflora in the intestinal tract. Several studies have been recently conducted on the role of probiotics in preventing and treating allergic disorders. Some impressive findings include the following studies. A 2005 study conducted at Ninewells Hospital and Medical School in the UK indicates that the management of allergies has been shown with probiotics reducing the incidence of atopic eczema. Probiotic treatment was demonstrated in infants using lactobacillus. Recent studies have shown that when probiotics are combined with minuscule amounts of peanut protein, it serves as a natural form of oral immunization and can help to alleviate peanut allergies and sensitivities. A 2015 study published in the Journal of Allergy and Clinical Immunology evaluated 62 children between the ages of 1 to 10 years who received combined therapy involving probiotic supplementation and peanut oral immunotherapy. Of the children in the treatment group, 89.7% were desensitized to peanuts and 82% achieved unresponsiveness, which means that they had reduced peanut skin prick test responses and peanut-specific IgE levels. Researchers concluded that the combination of probiotics and very small amounts of peanut protein induced immune changes that modulated the child's peanut-specific immune response, making them more tolerant to peanuts. In 2017, a follow-up study published in The Lancet Child and Adolescent Health was conducted to assess the long-term outcomes of the children who originally underwent probiotic and peanut oral immunotherapy treatment 2 to 4 years prior. 67% of the children in the original treatment group were still eating peanuts. 4 of the 24 children in the treatment group reported allergic reactions to peanuts since stopping treatment, but none had anaphylaxis. Researchers of this follow-up study concluded that this form of treatment provides long-lasting clinical benefit and persistent suppression of the allergic immune response to peanuts. Researchers have been studying the health benefits of probiotics in the gut. One team found in 2015 that provides a combination of probiotic supplementation and very small amounts of peanut protein to children, aged 1 to 10 years, helped them become more tolerant to peanuts. 3. Oral immunotherapy. In the last few years, there's been an increase in studies evaluating oral immunotherapy for peanut allergies. In 2018, a double-blind, placebo-controlled food challenge published in the New England Journal of Medicine found that oral immunotherapy in children and adolescents who are highly allergic to peanuts may lower symptom severity during peanut exposure. This was the third phase of ongoing trials testing the efficacy of oral immunotherapy, which is when patients receive a peanut-derived immunotherapy drug in an escalating dose program. Here are some highlights from the study. 551 participants with peanut allergies, the majority of whom were between the ages of 4 and 17, received a peanut-derived drug called AR101 or placebo in escalating doses for 24 weeks. By the end of the trial, 67% of participants in the treatment group and 4% in the placebo group were able to ingest a dose of 600 mg or more of peanut protein without displaying dose-limiting symptoms. The drug, which is called Palforzia, is a type of oral immunotherapy that's meant to expose patients with peanut allergies to increasing doses of peanut protein in order to build a tolerance over time. 4. Bromelain. Bromelain is commonly used as an anti-inflammatory and anti-swelling agent. But a study in 2013 found another health benefit. Researchers said bromelain worked effectively to reduce food allergies, asthma and dermatitis. It could reduce the prevalence of conditions affecting the airways as well as peanut allergy symptoms. A 2013 study published in Evidence-Based Complementary and Alternative Medicine tested the efficacy of bromelain against atopic conditions such as asthma, food allergies, and dermatitis. Researchers found that bromelain inhibited allergic airway disease, and the data provided additional insight into bromelain's anti-inflammatory and anti-allergic properties. These bromelain health benefits may help people with allergies to reduce peanut allergy symptoms and the results of an overactive immune system. 5. Supplement with a multivitamins. Research has shown that children with multiple food allergies are at a higher risk of poor growth and a deficient vitamin and mineral intake. Studies indicate that children with food allergies are commonly deficient in vitamin D, copper, zinc, and selenium. For children with allergies, a 3 to 7 day food diary can point out the possibility of vitamin deficiencies. Making sure that children with food allergies receive the micronutrients they need will help to boost their immune system and regulate their immunological response to allergens. Taking some supplements could help boost the body's immune response. A study with children diagnosed with multiple food allergies found that they have a higher risk of poor growth and vitamin deficiency. Food allergies could limit their intake of vitamin D, copper, zinc, and selenium. Giving children multivitamin supplements would help improve their immune system and regulate their immunological response to allergens. Final thoughts. Approximately 1% to 2% of the U.S. population has a peanut allergy, about 3 million people, a percentage that continues to rise. In the past 2 decades, the prevalence of peanut allergies has more than quadrupled, up from 0.4% of the U.S. population in 1997 to 1.4% in 2008 to more than 2% in 2010. It's most prevalent among children under 3 years old, and the risk of developing a peanut allergy increases to 7% for a sibling of a child with a peanut allergy. Peanuts are among the Big 8 food allergies, along with eggs, fish, milk, tree nuts, shellfish, soya, and wheat. If you like our videos, please don't forget to subscribe, and hit the bell button to keep you notified and updated with our latest videos. We are trying our best to give you the most informative health-related videos, regularly. Thanks for watching, The Health Room.